As I'm thinking about what we are going to be talking about tonight, I want to reflect, just read a verse here in Psalms 139, verse 14. The Bible says, I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knows right well. Doc, what a
fitting
for what we are going to talk about tonight. One of the things I'm picking up here is that no one can say, I made myself, I fixed, I designed this part of my body. No one can claim that. I'm not a learned man, but you can correct me if there is something you have learned in science that says, hey, you guys design organs of the body now.
No, I'll be lying.
Oh, okay. No, we don't want to do that then tonight. So tonight we are talking about an organ that is very small, but its impact is big in your life, in your day-to-day life. And that organ is an eye. So we're going to talk about why an eye is so important and what role does it play in our lives, and what are the mechanics of this thing we call an eye. We just see a ball, Dr. E, but we don't have the details as to what is this thing, how is it designed. But one can see that it's great design, because when you hear what David says, that I am fearfully and wonderfully made, marvelous are thy works, and that my soul knows right well. So let's talk about the marvel of an eye tonight. Dr. E, talk to me.
An eye is something interesting, very small, but yet complex. You know, there are volumes and volumes that have been written on the eye. An eye is a window to the soul. You can, if you want to know if someone is lying or not, if you look into the eyes, you can tell. The eyes can't lie. You know? Yes. So we're going to talk about the eye and how lifestyle diseases manifest themselves in the eye. You know, there are many diseases that we pick from the eye, even the congenital diseases that the children are born with. We can pick a lot of diseases and refer to the pediatrician to say, please wake out for this syndrome, or these strange names that we have in the medicine, but you can see through the eye. Sometimes, you know, we got parts of the eye, we got the white thing that covers the black, what we see, the black people we call cornea, and the people which is made of iris. Sometimes you don't have an iris, and we can tell, okay, there's something missing, and then we refer to the specialist pediatrician to look and check what's going on. So let me come with the eye and share my screen and talk about this eye.
We're ready.
You're ready? Yes, let's go. So yes, lifestyle diseases and the eye. And when we look at the eye, it has different parts. And I just tried to put a schematic eye so we can see, so when we talk, we can understand each other.
Yes.
So when we look at the eye here, you have at the front here, which is a little bit cut small here, is the cornea. And then there's a space in between, which is the anterior chamber. Then you can see where these two, they are marking, which is the iris. And then is your lens that makes you see. These things, they make you see the world you see. And at the back, there's the retina here with the choroid, which is, they contain nerve endings. And those nerve endings collect information and they give it to the bigger nerve, which we call optic nerve. And that information is taken to your brain. and then it's made into an image that you can see me, we can see Pastor Jay, we can see our lovely family. And when this eye is not working, one part of it is not working properly, then we have difficulties in seeing the world around us. You can even do a short test now just to check if both your eyes are working. Just close your left eye with your hand like that. Close your left hand and see if you can see your finger or something with your right hand, with your right eye. Yes, then you change. You can close the right eye with your right hand and look with your left eye. Can you see? So we can do that once a week, every morning. Choose a day, and you do that. Then you can see that your vision is deteriorating, or it's too stable, or it's worsening, something is happening. So you can look for that. So when we look at the lifestyle diseases, I know we talked about diabetes, we talked about hypertension. Those are lifestyle diseases. How does the diabetes affect your eye? It can affect the covering of your eye, which we call the cornea. We'll talk about it. Can affect the lens and cause the cataract. It can cause some new vessels and cause the glaucoma. It can affect the part of the retina, which we call the retinopathy. It can affect the nerves that will cause the eye to move. So we will go into detail with each of those different parts. So we look at the cornea here. In the cornea, when we have diabetes, we have high sugar. High sugar loves water. It loves water. So when there's high sugar in your cornea, it draws water into the cornea, and the cornea starts to swell. When it swells, then your vision is blurred or distorted. You can't see nicely. So it can cause that. And when there's a swelling, then the white part, which we call the cornea, there's a tendency to rupture. And we can see here on the below with the red eye, there's a shining part there. There is the tissue that covers there, we call epithelium, is off. So it causes an ulcer there. And sometimes because of this ulcer, it cannot heal, and you struggle to heal, then you can perforate like the other one. You can see some things coming from inside. The iris, the brown part of your eye, we call iris, is coming out, and because the eye is perforated. And diabetes has got that tendency because it causes loss of sensation, so you can't feel anything that comes into your eye. Sometimes you are touched by something sharp and you don't even know that you have an injury. So that's why we need to control the sugar. And because sugar has a tendency to go around your white blood vessels, your white blood cells, which are part of your defense system. They clog them and they cover them. Imagine you have a gun which is built in a concrete wall that when you shoot, nothing goes on. You shoot the gun, but there's a concrete wall, there's a bulletproof within it, protecting it. You can't use it. That's the same thing with our white cells when they are clogged and clotted by the sugar, which is high in our body. So it causes that infection then takes chance, and we can have infection like on the top. You can see the eye is not clear, it's hazy, it's got new blood vessels because of the infection. So it can affect your cornea. It can affect your lens, and when it affects your lens, it can bring about what we call a cataract. Here we see in the eye, between the brown that we see, which is the iris, we see the white opacified lens. The lens is supposed to be the window. So it's supposed to be clear like glass. But because of the sugar, the water is taken into the lens, into the cells, they swell, then they rupture, and they cause opacification. It's like a dirty lens. It's like a dirty window. You can't see through it. You have, so then we say you have to come to us and we do cataract operation. We put an artificial lens so you can see. But sugar makes this happen earlier in life. It happens like even we have operated 16-year-olds, 10-year-olds with diabetes, 20-year-olds, when usually cataract comes around 60 years of age because of aging, but now it comes early because of the sugar. So you find that sugar affects that your lens, and then when you can't see, you become blind, and when you become blind, we can operate and restore vision. But when you are blind, there are a lot of effects that it has on your family. I have seen where kids have stopped going to school because they've got to take umkunu around because the grandmother or grandpa can't see, or the mother can't see, so they have to stop going to work to accommodate them. And the person who's got cataract now can't go to work, so can't feed the family. That's why we will talk about some of the way and means how to control it. Sugar also causes your eye to develop new vessels. You can see these on the right side of your screen. You can see there are small vessels that are growing around the pupil. We call them new vessels, and those have a tendency to bleed, and you can see blood there, and then that affects your eye, and that blood and those vessels can cause what we call glaucoma, which is high pressure, and that causes the damage of the optic nerve. And optic nerve is very important because it is the one that collects all the information that the eye sees and sends it to the brain. So you can see the beautiful world that God has created. You can see your beautiful wife or your handsome husband or your beautiful kids. But when now it has been damaged, unfortunately, if the nerve is completely damaged, there's nothing we can do. We can't create, as you said, we can't create a nerve, especially the optic nerve. So we've been struggling with those who come late and then the nerve is totally damaged. So it can cause the bleeding, which we call hyphema there, and it can lead to blindness as well. So we need to see, because this is due to the sugar, because the sugar drives that the body must create new vessels to meet its blood supply demands. So we need to be careful. That's part of the effect of the sugar. The next I want to talk about is the nerves, the cranial nerves that we have. Cranial nerves, these are the nerves that comes from the brain and come to the eyes and supply the eye so that the eye can move. You know, we need nerves to tell the muscles you need to move. You need to move to the left, you need to move to the right, you need to move to the up, you need to move down so I can see what's happening around my world. But when we have diabetes, it can cause these nerves to malfunction. So to have what we call a palsy. A palsy is a nerve where it becomes weak and it can't do its job because of the sugar is high. It also gets swollen, like the eye, as we said, with the cornea, and then the nerve destroys its cells, then it can't function. And if we look at these eyes, if you look in the eyes in the between, I have 9 pictures, but look at the one which is in the center. That's what we call primary gaze, primary when you're looking straight.
Yes.
You can see the right eye, the lid can open nicely. But when you look at the left eye, the lid is almost closing the eye because the nerve that supplies there, which we call it third nerve or cranial nerve 3, it's affected. Because it's affected, it supplies the eye muscles that causes the eye to move. If you look at the top of it, the right eye is looking nicely up, but the left eye can't look up. When you look on the bottom picture of that, the right eye can look nicely down, but the left eye can't look down. When you go to the left picture on the screen, the left eye can't look to the right. You can see it's trying to look to the right, it's refusing, it's still in the center. But if you compare with the right eye on the left picture, the right eye is moving nicely to the position it's supposed to be. And this causes the limitation of the eye movement, and it causes a squint. So your eyes, it's no longer straight sometimes. And more so, you will find that you start to see double vision. You see 2 things when it's supposed to be 1 because of those changes in your muscles. So that's part of sugar. Just imagine what sugar is doing there to you. And then the big topic on this sugar is what we call diabetic retinopathy, where it affects back of the eye, where we showed you as the retina. And there it causes havoc. It causes a mess. And I'm just going to show you a picture. See, when it affects the back of the eye, you can see like that guy. We call it blurred vision. You see, this guy can't see the world around him. And that's because it just affected the back of the eye, which we call retina, where those nerve fibers are formed and they collect information, and then they give to the bigger brother, the optic nerve, to take it to the brain. So when your sugar is high, it affects it. We're just going to go through just now. What are the important things when you talk about sugar? We got what we call risk factors of sugar causing effects on the retina. The time that we have sugar, the duration, we have of diabetes, usually within the first 5 years when it's type 1 or 10 years type 1, those people who are born with diabetes or they get diabetes very early in childhood, usually they don't have anything, but after 10 years, 15, 20 years, they start to have problems at the back. Poor control, we'll talk about poor control. Pregnancy makes it worse. High blood pressure, hypertension makes it worse. When we have kidney problem, makes the sugar worse. When we smoke, we make the sugar worse. And just being fat, obesity, makes it worse. Or we love amagwinya, those fatty foods, hypercholesteremia, makes the sugar worse in your body. When you are lacking enough blood cells, the red blood cell, we call it anemia, it makes it worse. So you see all these things become friends, and to say, come, let's go and attack and make the eye our target, So we need to look at it and say, what is happening with us with sugar? As I say, with sugar, it has a tendency to increase the amount of water that comes with it when it's high in the eye. So it can cause leakage of the blood vessels. And when they leak, the blood vessels, they swell. And I'm going to show you some of the blood vessels where they swelling, okay? You can see here on this picture, we can see all the yellow things are coming because there's a lot of blood vessels leaking. Your fat, it's leaked. Then the fat comes as the yellow on the we see as the yellow on the eye here, and it's all over. You can see it swelling. Then because it is swelling, it also causes, because of the sugar which is high, it brings all the blockage of the vessels, and the vessels burst. They start to bleed. You can see the blood vessels here, they are bleeding, and that affects your vision.
This is the back of the eye.
It's the back of the eye. This is the back of the eye. And there at the center, which is where you see the blood vessels are coming out, that's what we call the optic nerve. And that is very important. So it collects all the information to itself. And here at the center, where it's reddish and not so clear, it means it's swelling, we call it macula. That's what gives you the best vision. That's what gives you color vision. If you lose that center of your eye, then you can only see black and white. You can't see color. And that's important, and sugar affects that. So it's important to look at it and see that this eye, we've taken care of the sugar. I'm just showing with the arrow here, the macula, which is the center. You can see here it's swelling, and normally it's supposed to be like that with the bottom picture, where you can see nice vision. And all those parts of the swelling is gone because we have done some treatment here of this patient. So, and with this sugar, it causes that because it blocks the small vessels, then the eye doesn't receive enough blood supply. So the eye tells itself, look, man, you don't have enough blood. So it means your blood vessels are failing. So what must you do? The eye tells itself, I must create new vessels. I must create. So here we can see around here, these small thing around the optic nerve, that round thing where the blood vessels, normal blood vessels, you can see it looks like a fan. Those are new vessels. And you can look at the bottom, there are new vessels because the sugar, when the sugar blocks those blood vessels, the eye says you don't have enough blood supply. Your blood vessels are not working, so you must act. So the body creates new vessels, but those new vessels are not as normal as the normal vessels. They lack certain part of the walls, and they are very delicate. Any change in pressure, anything can cause them to bleed. And then you have problems. I'm just showing you the new vessels. They look random. They are not nicely going around like the normal vessels. And they are not fearfully and wonderfully made because they are coming from a pathology, something that has gone wrong, not the original plan of God. The original plan of God is that it must be nice and straight and working well. But now there's something that comes like, can I help? But not equipped to help. So it can cause the bleeding, like the bottom picture I can see on the right. In the vitreous, we call it vitreous hemorrhage. I'm just showing you, so these things, the vessels that I was showing you that bleed. And so this bleeding can actually fill the back of your eye. There are people who come with sugar uncontrolled, they bled at the back with this, what we call vitreous hemorrhage. That is the bleeding at the back of the eye, and they can't see anything. They may, if they are lucky, they can see hand movement, or they can see light only. And then we have to do surgery, and we have to tell them the only best treatment is to take care of your sugar. If your sugar is not well taken care of, unfortunately, it becomes worse. This eye should be looking almost like this, with no blood vessels, with no leaking of lipids or cholesterol. But here in this eye, we can see in the center, which we call macula, it's swelling. It's not looking good like the bottom here. There's something there, some bleeding, small bleeding. So that also affects, that's part of the sugar. It's affecting the back of the eye. So how do we control the sugar? I think that's very important, to look how we control the sugar.
Yes.
What can we do? I'm not going to tell you about medical approach because you want, it's not part of you. That's when you go and seek help. But what can you do as a person? As a person is to make sure you can control your sugar by looking at what you eat. You don't eat things with high sugar content, fizzy drinks, coffee. You know these things, what they do to the body, they tell the pancreas, which secretes the insulin that controls your sugar. And when you take like coffee, it says, pancreas, you must wake up. There's a lot of sugar here in the body. And the pancreas produces a lot of insulin. And then there's a surge in the body. But because coffee is just a small amount of sugar, it's not proper food. When it deals with that sugar, it's like, there's no sugar here, it's just a little sugar. What shall we do with the rest of the insulin? Then the insulin goes back and tells the brain, the pancreas is overworking. It's giving us too much insulin. What should we do? Then the brain tells the pancreas, you must destroy some cells. You are too active. You are too active. You must take away some cells. Then that process goes on and off until your pancreas can't produce insulin. That's why you see many of our people, we have to start injecting now to give them extra insulin, because the food they eat, the drinks, the fizzy drinks, the coffee, the Coke that we drink, it just messes up with the sugar. And then it tells the false information and the body overreacts. So we need to control our sugar. It is what we eat, definitely what we eat. And the other day we said, you are what you eat.
Yes.
And the eye shows it, what you have eaten, if sugar is not well controlled. The blood pressure, we said it's a risk factor for the sugar to worsen the eye condition. So you need to control the blood sugar. We need to control the fats. We need to control the fatty foods. We like the fast foods. They are tasty to the mouth, but dangerous to the eye.
Hey.
Exercise is important, very important, as part of our holistic approach to, you need to exercise. When we exercise, we make our cells in the body sensitive to the insulin, and then they're able to break down the sugar faster and at the right rate. normally. But if we don't exercise, our cells become lazy. So they are not as sensitive to the insulin as they're supposed to be. And that's diabetes. And diabetes is a big thing with us. When we are fat, obese, then our cells also, they are not sensitive to insulin. The insulin we produce, then we are at risk of sugar. That's why we need to control our weight. We need to control our weight because it's very critical. These are important for, if you have kidney disease, we need to attend to them so that they are also controlled. If we have anemia, we need to go and eat our broccoli, beetroot, and spinach, because these, they supply our bodies with iron so that the anemia doesn't worsen our blood sugar control. So we need to take care of ourselves. These are some things that we just do to help you at the back of the eye so that you can have control. You see, when your sugar is not well controlled, look at that picture. Can you see, Mfundisi, what is there behind them?
Yo.
You see, this is what sugar does to the beautiful organ God created us to see the world. Sugar does this to the eye. That when you look, everything just looked blur. It's like a hopeless situation.
Yeah.
So we need to take care of ourselves. And God has created us with wonderful organ. One person asked me, would you rather lose an ear or an eye? I said, I'd rather lose an hearing because I don't want to listen to all gossip. Yeah. Gossip on media, wherever, you know. But if I can see the world, I can do many things.
Yes.
And I've seen when you have a cataract, we give you a new lens, how the person is so happy. So let's control the sugar. Let's control the sugar. Let me move on with this sugar. This sugar is terrible. Do you see this eye? Do you see these yellow bands around the eye?
Yes.
Those, because of the new vessels, they form what we call fibrovascular membranes, which are these bands. These bands, then they pull the retina away together so that it is detached. Where it's supposed to be attached and do its job, then it's pulled by these bands. And it's separated like this, where you see at the bottom here. So when it's separated like that, you can't see as well. Your vision is disturbed and distorted, and some people come and we try to repair these eyes, but it's too late because we need to prevent them forming those membranes because they pull the retina away. You know, when they contract the vessels, when they are dying, they pull everything together, form a scar tissue, and cause your retina detachment. That's where the retina is coming from the back, and now you can't see. And then you have to go through a lot of surgeries and all that. That we can prevent by just following the principles we talked about, how to control the sugar. And we can do that very much, you know, controlling the sugar. And we can see that we are well taken care of. Let me quickly talk about hypertension. I see time is moving fast.
That's
Am I
fine.
still okay?
No, you're fine. You're fine.
I'm fine, Pastor Jay.
Yes.
Okay. Now we say high blood pressure and diabetes, they are very good friends. You could say they are companions.
Yeah.
Many people who are diabetic, they are hypertensive. Many people who are hypertensive have diabetes. They go together. They are very intimate friends. So watch the two of them. The blood pressure, when it's high, it affects our blood vessels, especially the smaller ones, and it causes them to harden. And when they harden, they lose the elasticity, so they can't dilate or constrict. So it's like a pipe. If you have a steel pipe, when you increase the pressure, the pipe can't expand. That's what we do to the blood vessels with high blood pressure. Normally, the blood vessels are supposed to expand when the pressure is high so that you don't feel headaches, you don't get strokes, you don't get all those things. But when they have hardened and lost their elasticity, then those blood vessels can't expand. Then we are at risk of a stroke. The same risk we have a stroke in the head, is the same risk in the eye. Many studies have shown that people with the stroke of an eye, they will have a stroke of the brain within 6 to 8 weeks if they are not attended to. So we need, the eye tells us a lot. That's why the eye tells us a lot about the lifestyle diseases. So you can see what the eye does. It affects the blood vessels. Instead of being nice and red, you can see here, it's like a silver wire. It's like copper wire because they've been thinned by the blood pressure. So it causes the narrowing of the blood pressure of the vein, of the arteries and the veins, and that can cause obstruction, which we call retinal vein occlusion or arterial occlusion. That's supposed to supply the eye. And you can see some of the things, the same that the diabetes does, the yellow stuff, we call exudates. Those, they come from the blood vessels that are leaking because they've been thin and obstructed. Then where there's obstruction, then they swelling and they start leaking again. So we are looking at the back of the eye here.
Yeah.
There is the red part we see is the nerve. It's supposed to be nice and yellow, but now it's swollen. The blood vessels are swelling because of the high blood pressure. And also, if we look at where there's a lot of yellow stuff that are bright shining, like as if it's a sunrise, that's where the macula is supposed to be nice and dry, but here it's swollen, it's wet, so it also affects your vision. So we can see what the blood pressure does. It affects your retina, causing retinal vein occlusion. It causes the nerve that we're talking about, the nerve pulses, weakness of the nerves. It worsens the diabetes. It can obstruct your blood supply, which is the arteries. It can cause new membranes, tissues to grow over your eye. And it can cause also new blood vessels, which are also at risk of bleeding. Here are just examples of what I'm talking about. We can see here in the top, on the left picture top, you can see there's bleeding there because of the obstruction there where the blood vessels are crossing each other. So there's obstruction, then that's bleeding. What you see that looks like fire, oh, that's blood, that's bleeding. You know, just from the blood pressure, it has caused all this bleeding.
That branch vein
occlusion.
Yes. That's what you talk
so
about.
You see, yeah. So when you look at the top there, when I'm talking here at the top, you can see the blood vessels where they cross. They've caused the blockage there, and then the rest of the blood vessels in the periphery, they are bleeding. So it gives you that flame fire. It's the blood that is bleeding there. And now the central vein occlusion is worse because it's the central from the optic nerve from the center. So as it supplies the whole of the retina, it's bleeding everywhere. And that causes the swelling of the eye, and that swelling of the eye causes the loss of vision. Because the eye is swollen and it's bleeding, the body again tells itself, the eye says, hey, something is happening here. We are bleeding a lot. It means we are not getting enough blood. And the blood vessels are blocked. So we need new vessels. So like diabetes, then it develops new vessels. Those new vessels are not strong enough. They bleed again. And they cause what we call glaucoma again, that we talked about, that affects the nerve. So it's a vicious cycle. So then so that's why we need to control the blood pressure. Then again, we are at risk of losing our vision. The nerve, as we said, it can swell and destroy the cells that's supposed to receive the light, or that it goes into the eye for your vision, and then your vision is affected. Here is an artery occlusion. Now here you can see the big red vessels, those are our veins, but the color of the retina is white. You can see it looks white. It's supposed to look nice and red, not as red as this one, but you can look at, when we look at the branch at the bottom here, that's the color it's supposed to have.
Yes.
When you look at the branch vein occlusion picture, the top part is bleeding, but the bottom is nice and good. This one is white, which means the eye doesn't receive blood. Now that's an eye stroke. That's the same thing that we call a stroke in the brain. The same thing that is happening to the eye happens in the brain. And when you have this happening, immediately we send you to the physicians to make sure that they check you, or the neurologists that they check you quickly to prevent having a stroke, because you're at high risk of having a stroke. So we need those. You see, the eye can show us what's happening when you don't even know. You're like, I can't see, I've lost my vision. We look like, hey, you're at risk. Do you have high blood pressure? Yes. Do you have high cholesterol? Yes. Do you have diabetes? Yes. Do you smoke? Yes. Do you exercise? No. Do you sit and watch TV and eat every food? Yes. Do you eat chips? Yes. Salt things? Yes. And like, oh man, the risk is just beyond me. I must rush you to make an urgent booking with a specialist for the brain or the physician, so they can look at you and control all these risk factors. But number one, you can do it. Control what you eat. Don't eat very salty food. Don't eat high fatty foods. Don't smoke. Don't drink, because it worsens the issues. Go and exercise, you know. Eat your veggies. You can eat as much as you want if you eat veggies. Yeah. But don't eat meat like as if, you know, because meat raises the sugar, raises the cholesterol, raises the blood pressure. So watch out the amount of meat you eat. Control the tinned foods. They have a lot of salt because they have to preserve. So rather cook your own meal, and you know what you put, the devil you have put in your food, rather than the devil you don't know. If you ever looked at Mfundi's, Pastor Jay, when you buy canned food, did you see how many E's are there?
Yes.
E5106. They are not standing for Emmanuel. They are standing for evil. They are standing for evil. So we must watch those things. The more E's that are there, the more evil it is.
Yeah. Look, some of them you can't even pronounce.
That's it. You can't pronounce.
Yeah.
You see. So as I come to just to conclude with the cholesterol, when we have cholesterol, it causes our blood vein vessels in the retina to be creamy white instead of nice and red. If you look at the picture Fig 2 on your left, you can see the blood vessels, they are whitish and creamish. They are not as good and red as on Fig 3 on your right. So that's what cholesterol does. And that cholesterol can form what we call an embolus that blocks the blood vessels. And we go back to retina vein occlusion or artery occlusion, or, you know, then you have trouble. So that's why we need to control our fat food that we eat. Fat is good if you take it in a limitation, that required amount. Fat is good if you exercise. Fat is good if you put it where it's supposed to be, but we love fatty foods because it's tasty.
Yes.
Have you ever tried to eat meat and take all the fat from it? It's like you are eating a
tissue now.
A tissue or a dried bark from a tree. You know, it's like tasteless.
Yes, of course.
So
the taste is fat.
Yes. So definitely through the eye, we can see what's going in your body. We can pick what, you know, I didn't talk about other things like cancer, breast cancer. We can pick that in the eye. Most of the times we pick a cancer in the eye, like, do you know you have cancer somewhere? No. So we have to do the body check and like, go to the surgeon, your breast has got cancer, because the cells we see here, they tell us that is from the breast. We look, this cancer is from the prostate or from the lungs. So a lot of things we can pick from the eye. May God bless us, because we are fearfully and wonderfully made. And the eye is a window to our soul. May we take care of that window, because if we destroy the window to our soul, then how are we going to be able? How are we able to see inside and to have introspection? So we must keep an eye single to the glory of God. May God bless us as we take care of our lifestyle.
Wow, thank you very much, Doc. Hey, This is Revelation 23 presentation.
Revelation 23. We praise the Lord.
You know, I just want to reflect on a few things here.
Yes.
That to me really, I mean, yeah, Revelation 23. Number one,
yes,
that eyes can have ulcer. Talk to me about this one.
Yes, and eye, just like your leg, when you're diabetic, when you got a leg, we got a diabetic ulcer. An ulcer is a cut in your normal tissue. And that when that normal tissue is cut, you lose that tissue. Like when we have diabetes, those who go for diabetic food, you can see an ulcer. It's like when you get a cut on the hand. Now on the eye, it happens because the sugar is so high. So the sugar gets the water into the eye tissue swells. Because it's so swollen, it bursts. And when it bursts, it's like you have a blister. You have a blister that bursts, and that bursting, it forms an ulcer. And sometimes because of diabetes, it's difficult to get that ulcer to heal. We actually have to do some surgeries. Sometimes you end up having a cornea transplant because your eye can't heal. You can't see now, or it heals with a scar. That scar now divides your eye into two. You see two things with one eye.
Yes.
So that ulcers, So we need, just like you have an ulcer in the stomach when we don't eat right food, the same happens to the eye. So we can tell.
Now, I'm also amazed about what you mentioned about cataract amongst young people.
Yes.
I've never heard this one. Is this a growing problem?
It is a growing problem. It is a growing problem with diabetes. In fact, today I was seeing a 19-year-old from Qwaqwa with one eye, the retina detachment I talked about the eye is detached, pulled by the membranes of diabetes, and he has cataract at the same time. We can't even see at the back. We have to see through, we use a special machine we call B-scan to be able to see at the back. At the front, there's cataract. It is just gone with cataract. It says, no, I've lost this vision. I've been struggling for the past 3 years. It's a 19-year-old. A 19-year-old supposed to be at college or at school. I'm finishing my trade. But now this lady, we have to admit, we have to look, the other eye is bleeding because of the sugar is so high, it's uncontrolled. The pictures that I showed you bleeding. And you're like, we are not sending you home, because if we send you home, we're going to lose your eye. Your eyes, we need to ensure at least we keep the left eye's vision. So it is a growing problem with the young people. Sometimes they use the problem with our young people. Let me just talk to them at this moment. They know that they are diabetic. And they know if they eat cakes, they drink fizzy drinks, chocolates, sweets, chips, a lot of meat, the sugar goes high. So if they want to say, Papa, I want a new iPhone, and you say, I can't afford my daughter or my son, then they go and eat those things. And the sugar skyrockets. Sometimes they go into diabetic coma. They come to hospital in diabetic coma. But all that effect that is happening in the eye as well. So now by the time they come to us, what's going on? No, I've been struggling controlling sugar. Why? No, my parents don't listen to me. So they use that to manipulate the parents, not knowing that they are destroying their vision. They are killing themselves in the process. When the eye is affected, it means the heart is affected. It means the kidneys are affected. It means the blood vessels are affected. It means the brain is affected, even though it's not yet peaked. When the eye is affected, it tells us the whole system is being affected already.
So these things are connected, Timos, eh?
Very connected, my Pastor J.
Now tell me, what causes glaucoma?
Okay, glaucoma in simple is the damage of the optic nerve. You remember the nerve I showed you?
Yes.
That collects the information to the brain. At the back, it takes the information to the brain from the eye. So what happens is that nerve is damaged. the number one cause of the damage is pressure. The eye has pressure, just like we have pressure in the body.
Yes.
So the normal pressure is between 10 to 20 millimeters of mercury. So sometimes we have pressure that goes up and it shoots, then the eye is so hard. And what happens is that it compresses on the nerve. Then the nerve doesn't get blood supply.
Yes.
So because it doesn't get blood supply, the cells, they die because they need blood supply to live, to continue functioning. And that's number one. Number two, it can happen from trauma. Trauma damaging the eye can cause that nerve damage, or even pressure on the nerve. So number one, which we can control, is the eye pressure. And that high blood pressure and diabetes, there are risk factors, and even cholesterol and kidney problems, there are risk to increase the pressure in the eye. So then if we control those things, we control the pressure. Unfortunately, as blacks, we are at great risk of glaucoma because of genetics. So when we have these other things, it's like pouring petrol on top of the fire. So you're just making the situation worse. So then when we have that damage of the nerve, unfortunately, when it's completely damaged, we can't do anything. So when you have glaucoma, we give you drops or we do surgery, try to control the pressure so that we can keep the vision that you have.
Now I want to talk about this optic nerve, because as I'm listening, I see the value, the critical role it plays in the eye. When it comes to the optic nerve, is this something that one can go to the doctor and say, look, I just want to check the status, the health status of my optic nerve?
Right. We can, what we normally recommend, you can go to you can go to your doctor, GP, they can look, they're supposed to have an indirect, just to look at the nerve and whether it's healthy or not. We can go to the optometrist, they can check our pressure. Here's the optic nerve, I'm just showing them. They can check the pressure. They can also look at the back of the eye and see if your optic nerve, because it's important. When you have lost your optic nerve, you have lost your vision. It's critical. It's critical to look at it. So if you have a risk of a family member with high pressure of the eye or glaucoma, you need to check. We always recommend that the whole family must be screened. Go for screening just to look at the nerve, check pressure to see you are still okay. So you can go to your doctor, they can have a look at the nerve.
Now tell me, what is it that one can do to make sure that you keep the optic nerve healthy?
All right. Optic nerve, as we said, prevent trauma, hitting to the eye. These guys, when we are drunk, we like to hit the eye. Or even when we are playing, we like to hit on the face. Prevent anything that can cause trauma to the eye, because that causes pressure to increase. Prevent, so you prevent home fightings if you have, or in the street, okay? Prevent the getting high blood pressure, cholesterol, and diabetes, because they are risk factors. Exercise, drink enough water, eat vitamins, especially vitamin A and vitamin E and vitamin C. They are very important for the eye. Those three vitamins I just mentioned, they are very important for the function of the eye. So those ones, you must just make sure you got your fruits, they supply these vitamins, and you have enough of those. It keeps your eye healthy. And in actual fact, they use these vitamins to transfer information from the eye to the brain. So you need to keep on those. They look like it's nothing, the vitamins, but they are very vital on our body system.
Now let's talk about the eye muscles.
Yes.
When you talk about a muscle,
yes.
I obviously think about exercise. This is something that stretches, that must be kept fit, and so on and so on. So,
Yes.
so what is the role of this eye muscle, and what is it that I can do to keep it strong?
Okay, the muscles, they move your eye. So if I want to look to the left,
Yes.
the brain tells the muscle, that is we call them rectus muscles. There's a medial one on the right eye, the left one will be the lateral. Then it tells them you need to contract. Then they look that side. And if I need to, then they tell the other one, the opposite one, you must relax, because so that there's no conflict. And that's how beautiful and amazing God has created the eye.
Wow.
They coordinate to say, you know what, we are looking to the left. So the other ones, you must relax. It's not your job now. Take a break.
Yes.
We look. So they do that. Then when you look up, certain muscles, they work as well. So what we can do just to keep our eyes, our eye muscles, is when you read,
Yes.
when you read, you make the eyes work. You make the muscles read. Then when you read, don't keep reading for more than 45, 30 minutes without taking a break and looking into the far distance. Take a break. For 5 minutes, walk around and look into the distance. That relaxes the muscles and works the other muscles, allows the other muscles to work. So that keeps the muscle balance, because sometimes we got what we call tiredness of the eyes, where people say, I feel my eyes are a little bit painful, they're tired. We have a term which we call asthenopia, which is just a medical term to say eyes are tired. So we need to sleep as well. We need to sleep to relax. If you overwork a muscle, you may rupture it. So you need to do moderate as well. You need to sleep. When you sleep, the eyes is resting. And then you also wake up. So that balance needs to be maintained.
So this reading is good for these eye muscles, eh?
It's very good. It's good. So don't get tired of reading.
Wow, that's good. Now you were interestingly talking about stroke of an eye.
Yes.
Evan, an eye have a stroke. Talk to
yes.
Yeah. Yeah.
You see the stroke is caused because of the blood vessels that rupture or that stops from that causes the obstruction. So when you have an obstruction, just like here, you can see the bleeding. Let me just go back to the picture of our strokes so that we can just recap on this stroke.
Yeah.
Okay, I just want to put the picture here on the background as we look at the stroke. Okay, here I am. Okay. So here, you see when the blood vessels in the eye is obstructed, like the branch vein occlusion.
Yes.
Then wherever it's obstructed, it can't drain the blood, then it bursts open and it bleeds. That's a stroke. And this is exactly what happens in the brain. It has a stroke and it affects a certain area of your eye, of your brain. Then you can't move a certain hand or set that leg, or the face will be twisted because the nerves are affected by that stroke. Even with the eye, someone will come and say, I can see black thing on the bottom when the top is affected. So I see a black shadow here. The rest I can see, but there's a shadow because then the nerve is not functioning. There's a stroke of the eye. Worse off with the central vein occlusion. Like they can say, I see just a shadow. I don't see any color. I can see that something is moving, but I can't make what it is. So the eye can have a stroke, either from the obstruction, from the thrombus, or from the ruptured vessels that are bleeding. And it's worse when it's the artery. When the artery affects, then nothing much we can do to restore the artery. Sometimes we are lucky, like this one, we can see that red spot. It means there's a one we call a cilioretinal artery is still functioning. So this person's vision may still be good because of that, because this is the center of your vision. But we have stroke in the eye. And as the eye has a stroke, it tells you that you are at risk of having a brain stroke. So watch out, which we call CVA or cerebrovascular accident. And also tells you, watch out for your heart. You may have a heart attack because what's happening in the eye, heart attack, it's like a stroke of the heart. We call it heart attack, but it's a stroke of the heart. Yes. So this can happen in any organ, but eye is susceptible to that as well, especially when sugar and blood pressure are not well controlled.
Interesting stuff here. Interesting stuff. I see that you are left with 3 minutes here. Now, Doc, you were talking about the leakages that may happen in time. Now, when you, I guess then maybe something has ruptured your veins or whatever. Whatever the cause of that leakage is, where is this blood that is leaking, or those liquids, where are they going?
All right. Some of them, they leak into the retina itself. So then the retina gets swollen and then it can't see, it can't perceive the information well. Some of them, it goes into the vitreous. There's a space between the lens. Let me just go. Okay, I think I have a picture here. There's a space between the lens and the vitreous. Let me go to the top so I can show you that space. All right. So here they see where's the lens, which is like spherical, nice here in the eye. And then the back of the eye, between that lens and the optic nerve, that space, we call it vitreous because it contains a gel, which we call vitreous. And so the bleeding goes into that gel. And then we call it vitreous hemorrhage, and it blocks your vision. So sometimes it leaks and then it just swells into the nerve. So we have to treat to reduce that swelling. We have various treatment that we do in the eye departments. We have injections. We have laser. Now with this bleeding, if it's bleeding into the eye, then we have to do operations at the back of the eye to take out the blood, and then laser where it's bleeding so that you don't bleed again.
Oh, okay.
Yes.
Wow, that's amazing. Then lastly, on my part, Doc, this issue of, which is very amazing also for me, the detection of cancer in your body.
Yes.
Through the eye.
Yes. So what happens when the body has got cancer, the cancer usually spreads to different parts of the body through the blood. So through the blood, you get the cancer coming from the lungs, from the liver, from the breast, from the prostate, and it comes through the blood supply into the retina, and and then the cells are lodged there. Wherever they are lodged, they start growing. So when we look at the back, you can see actually that there is a lump here in the eye. So you have something like a lump in your eye, and we look at it. This is not normal. And we do tests to take some biopsy and go and send it to check what is going. And most of the times you pick, no, it's a cancer from the breast. The cells, they're coming from the prostate, or they're coming from the intestines. So the eye can also get eye cancer of itself. Yeah. It can get cancer that can go also to different parts of the body. So it exchanges the cancer, it receives cancer from other organs, and it can also have its cancer that goes to the lungs, to the liver, to the bone, So we need to check. So we check and see where is the source. So we work closely with oncologists because we have so many of these cancers. We know children may have cancer which we call retinoblastoma that may appear like cataract, but actually it's a cancer of the back of the eye. So some children are born with that, or they develop it early in their childhood, before the age, mostly around age of 2, 3, and 5, around that age, before 5, most of them, they develop that cancer. And we can pick it through the eye when you look, and you can see, no, actually this is a cancer that is growing from the retina, that's growing, or it's actually growing from the back of the eye, or it's growing from the front of the eye, on the conjunctiva, so we can pick a lot of cancers as well.
Wow, thank you very much, Doc. Look, the the enemy of our program tonight is time. It's nothing to do with you.
All right.
And I mean, we could have discussed it some more, but I mean, this is mouthful. This is mouthful, you know.
Yeah.
So thank you very much for this information. We are now wiser than we were an hour ago. And
praise the Lord.
And what also is it's so outstanding for me and for our listeners tonight is the fact that there is a connection in our organs of the body. I mean, it's a reflection of the text that we opened with in Psalms 139, verse 14, that we are truly wonderfully made by God. Marvelous are his works. And I just want to say to our listeners tonight that let's do all what we can to take care of the body that God has given you and make sure that it functions at an optimal level so that we can serve him with our bodies. And the Bible says that our bodies are a temple of the Holy Ghost. And so we wanted the Holy Ghost to reside in these bodies cleansed, so that as we await the coming of Jesus, we may be able to be good example in terms of health to those with whom we come into contact. And so thank you very much for this information, for these lessons that you keep giving us. May the Lord truly bless you with more wisdom to continue to benefit us.
Yes.
And this brings our program tonight to an end, and we will meet again next week, 7 o'clock on Friday. Until then, stay faithful. Remember that when you eat, it's either the food eats you or you eat the food.
Yes.
And tonight, I want to suggest that you eat the food by making the right choices. God bless you.
Amen. Amen.
Bye-bye.
God bless. Bye.